Hi, this is Julie Fast. I'm the author of Get It Done When You're Depressed, Take Charge of Bipolar Disorder, and Loving Someone with Bipolar Disorder. I've tried to make this video maybe 7 times this morning. I kept having panic attacks and anxiety that were preventing me from dealing with the absolutely normal things that come up when you try to work. I just wanted to say that at the beginning of this video so that anybody watching this video is about rapid cycling bipolar disorder, can know that we can work through our symptoms and get things done. I want to give that message. So you will find me a little more distracted during this video. You'll notice that my eyes will dart a little more. I have more dry mouth or an excess of saliva when I'm anxious, but I'm going to do the video anyway. What is rapid cycling bipolar disorder? Bipolar disorder is an illness that affects everybody in the same way. Everyone with bipolar disorder has mania, and the vast majority of people with bipolar disorder also have depression. Yes, there is a form of bipolar that's mania only. It's rarely diagnosed, though. So when you hear me talk about bipolar disorder, I'm talking about the more common form, which is mania and depression. You cannot have bipolar disorder if you don't have mania. The difference between each person with bipolar disorder is the duration of the symptoms and the intensity of the symptoms. Bipolar disorder 2 has hypomania, and bipolar disorder 1 has full-blown mania. So that's about intensity. But duration has to do with what we call rapid cycling. How long mood swings last and how much space, called euthymia, stable mood, is in between our symptoms is the very definition of rapid cycling. The Diagnostic Statistical Manual, which I think it's an okay tool, I have to say I'm not a huge fan of it, defines rapid cycling bipolar disorder as having 2 to 3 or more mood swings a year, which of course makes me laugh because anybody who's getting help for bipolar disorder almost always has more than 2 mood swings a year. But that's the definition. Are there some people who have a massive mood swing and then go years and years in between mood swings? Yes, but they're rare. They tend to respond to medications a lot more, and they're probably not looking at videos like these in order to get help for themselves or a loved one. So like people who only have mania, let's put the people with bipolar disorder who do not have rapid cycling, let's put them to the side, and let's talk about those of us who do have more than 2 mood swings a year. Rapid cycling means that you go between depression, stability, and mania. So it's this infinity kind of loop. On one side, you'll have people who, let's say, for example, will have a 3-month cycle, some space in between, and then a 3-month cycle. On the other side, you have me. I have a form of the illness called ultradian rapid cycling, and I have mood swings every day. The longest I go without having mood swings is maybe 2 or 3 days. I am triggered by everything, and so my rapid cycling is constant. In 2010, when my illness just sort of went through the roof, 2009, 2010, completely without a trigger, my bipolar disorder got just so much worse. And I found myself going into the type of rapid cycling that was hourly. So not only do some of us have daily rapid cycling, there are the few unfortunate of us who have hourly rapid cycling. I think that's the reason that I can put out so much content and I never run out of things to say online or in my books or with my thousands of articles, is because I live with bipolar every day. It just is never gone. It never goes anywhere. And management is the only thing that works for me because I've never responded very well to medications. Why is it important to know what kind of rapid cycling you have? Well, the back of Take Charge of Bipolar Disorder has a chart that you can use. I'll show it here. Let's see if we can just zoom in for that for a minute. And as you can see, That straight line is stability, and you can see me go down, 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 up, down, 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 up, down, 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 up. That is an example of rapid cycling bipolar disorder, and why does that matter? It matters enormously because it affects the medications a person can take, and it means that outside substances and events are going to be far more triggering for a person with originating who has rapid cycling bipolar disorder than someone who has a less of a problem with rapid cycling bipolar disorder. For example, because I was born genetically with rapid cycling bipolar disorder, when I was given SSRI antidepressants in the 90s, I'm not even going to get into it how horrific that was for my brain. I went from more of a rapid or ultra rapid cycling bipolar disorder person, which means that I would have maybe 20 or 30 mood swings a year, to someone who eventually would have 200 to 300 mood swings a year. So putting SSRI antidepressants into the brain and the body of someone who has rapid cycling bipolar disorder is actually one of the most dangerous things that anybody can do when trying to treat the illness. So knowing that you have rapid cycling bipolar disorder means you should never, and I stick to this, and my beloved co-author, Dr. John Preston, who is a psychopharmacologist, has trained me very well in this as well. We should never take SSRI antidepressants, and I truly believe that people who have ultra rapid cycling, let's say 20, 30 mood swings a year, or even those who have 10 mood swings a year, for example, should never use SNRI antidepressants either. Rapid cycling is affected by the following substances: stimulants, ADD medications, cocaine, methamphetamine, and a lot of amino acids that affect the mood, anything that affects serotonin, steroids, because they can affect the mood, and ultimately, like I said, SSRI antidepressants. So knowing that you have rapid cycling means that you can tell your healthcare team, no, I'm not touching those. You cannot give me SSRI antidepressants. If you're a parent or a partner and you want to learn more about this, you can simply type in Julie Fast. I've done some writing on what I call the bipolar dirty dozen, but you can type in Julie Fast antidepressants and read a lot more about this. Here's my policy. If you have a loved one with bipolar disorder, and that bipolar disorder is really up and down and up and down and up and down, no SSRI antidepressants can go into that brain, because you will absolutely increase the stimulation and the serotonin that leads to more rapid cycling. And what will happen is the person will then need a mood stabilizer to stabilize what happens with using SSRI antidepressants. That makes absolutely no sense. Going in and treating depression without SSRI antidepressants is so much smarter, because you then don't have to put in a much stronger mood disorder medication on top of it. The majority of people with bipolar disorder who are on meds, they're on a depression medication and a mania medication. To put a depression medication into the body that increases mania and then simply increasing the mania medication, mind-blowing. I'm going to end this video with a very contentious topic that no one's probably going to want to hear. And the number one problem I see today with rapid cycling increasing, as well as increasing duration of our symptoms and intensity and rapid cycling, is the THC in today's cannabis. I don't touch marijuana ever. And I used to love weed, so please know that this is not a personal attack on cannabis. I would smoke it if I could. It increases rapid cycling very intensely, first of all, because of its hallucinogenic properties. But the main problem is that it's stimulating. Out of all of the cannabinoids in cannabis marijuana, THC is the most stimulating. It's not the calming. It's not the CBD. It's the stimulating. So if you have more than 2 or 3 mood swings a year, you're a rapid cycler. If you have, let's say, 10 or 20 mood swings a year, you're an ultra rapid cycler. And if you're like me and you live with, you never know what mood you're going to wake up in the morning, You're an ultradian rapid cycler. No stimulants. I know. We want them so badly. We have ADD symptoms. But no, we can't take them. No cannabis, marijuana, because it will make us worse. No SSRI antidepressants, and in my opinion, no SNRI antidepressants. And no steroids, and no amino acids, such as taurine, that affect serotonin. What do we do instead? Talk to your healthcare professional about non-SSRI medications. Use the drugs that help with mania, because they often can also help with depression. And use the ideas. I really cannot strongly enough recommend take charge of bipolar disorder, because as a person with ultradian rapid cycling, who has had years where I had over 300 mood swings, I still managed to have a life. I still managed to write books and get out and have relationships, and I didn't die. So lifestyle changes, including sleep, are the number one way of managing rapid cycling bipolar disorder. Do you have rapid cycling bipolar disorder? And if you do, does your treatment reflect rapid cycling? And are you getting treatment, which usually is medications, therapy, and working with your doctor, that is stopping rapid cycling, not adding to it? And do you have a management plan in place that includes lifestyle? Travel is an enormous trigger of rapid cycling, unfortunately. Marriage, like a wedding, is a big trigger, or the birth of a child. And I'm not talking hormonally, I'm just talking about change. Do you have a management plan that helps you manage rapid cycling so you can have the life you want? Thank you.